Hi, I'm Melinda Tasqueta-Mullane, Editorial Director of Imaging Technology News, and we are here today at SIIM 2015 with Don Dennison, who is Director at Large on the Board of Directors for SIIM, and also was the opening keynote speaker for SIIM 2015. So welcome, and thank you for speaking with us.
My pleasure.
Your keynote session generated a lot of conversation, a lot of interest. Can you tell us a little bit about the topic that you spoke on?
When we look at healthcare today, especially for imaging informaticists, there's two trends that everybody is faced with, or dealing with, or trying to solve. One is EMR adoption. All of the people are either in a hospital that is adopting an EMR, replacing an EMR, upgrading an EMR, optimizing that EMR for imaging practice, and it's affecting how their operations run, their decisions, and everything, and it's consuming a lot of resources. And everybody's trying to learn how's the right way to do that. The second trend is consolidation. So hospitals are affiliating or merging and acquiring and growing into these health networks so that they can have all the variety levels of type of health service in all the different geographics and all the different care settings. And when combined with that EMR that sits above all those things, then it gives them an opportunity to create one integrated health network so a patient can go into any one of those care settings and all of their information is together. In parallel to the EMR consolidation integration, we need to do the same thing for imaging. So what my talk really was about was, as we consolidate all of these hospitals together, we as imaging informaticists have to start, one, we have to understand how do EMRs view our type of data? How does the information they can provide to us, how is to best use that in the imaging informatics? When we create content, images, results, what is the best way to provide that back that's interoperable with the EMR, accessible in the EMR, properly associated with the way the EMR sees the patient and the encounter and the procedure, so that when people are consuming that patient information, imaging is seamlessly in there, and it's an equally usable, accessible piece of content for that patient as lab values and other textual information. So as part of achieving that, there's a lot of things we have to start to change in terms of some common perspectives. We have to start looking at ourselves not just as a department in radiology, for example, that is responsible for taking images, reading studies, and sending reports off. We have to start to look at the content we create is actually part of the medical record. So we now have to start to look at those images, and we are a steward of that medical record, just like the people on the EMR team. So we have to start holding the data that we may manage and the data that we create to a higher standard, because it may be good enough to get the report generated and for the department revenue to be recognized, but it may not be good enough that once we mix it with all these other facilities, remember all these people are consolidating the data together into one EMR, it may be disjointed, not as easily discoverable because they're using different identifiers. So a lack of consistency at that level is going to make imaging look very poorly in the consolidated EMR era, and we can't afford that.
Right.
The second thing is this whole process of organizational integration, system integration, data integration. The imaging informaticist profile has an enormous amount of skills and experience which are going to be needed at that level. So we need to start to become ambassadors of good practices when it comes to dealing with procedural data, dealing with acquisition workflows, dealing with customer service, dealing with referring physicians and the different clinical systems. Second to lab, radiology touches the most patients and systems, so we're very horizontal. So we are in a unique position in this consolidated enterprise to actually be a positive force for change and someone who can avoid a lot of cost and use all the lessons we've learned. We know storage, we know networking, we know interfaces, we know informatics, HL7, clinical data. We could be superstars in this, but we need to start to go out, learn what's going on at those levels, start to think of how our activity fits into that system, and then build those systems that are actually going to get the efficiencies to get the payback on the EMR. It's not some arm's length system that somebody else is managing. We're part of that system, organizationally, data-wise, and system-wise. So I think really the talk was about those type of changes, and there's an enormous number of talks that are going on through these days, and solutions you're finding in the exhibit hall that have all been started to gear towards that,
Right.
where in the past it was really about productivity within the radiology department. Now we're open.
Right.
Now we are just one of the tenants on the enterprise, and if we embrace that, we're going to do very well. And that's what where I think SIIM plays an incredibly valuable role.
Excellent.
To give our members those skills, those learnings. Some of the talks are incredible, what people are doing that are already there, and they're sharing that knowledge, and people are, standing room only trying to learn, how can I get that at my facility?
Right.
And that's the great thing about SIIM, is the openness of which people are willing to share their learning.
Right.
And I just love it. It's great.
Again, this was a hugely popular topic, big buzz around SIIM. If people would like more information on this, where do you suggest that they go?
SIIM.org, one-stop shop. Imaging Informatics.
Great. Thank you, Don.
Thanks.
Appreciate your time.
My pleasure.